Children who've experienced childhood trauma can often use risky behaviours to communicate and get their needs met. These behaviours can be really worrying for parents, carers, and those supporting the child. I'm going to talk about 5 risky behaviours that we often see from children who've had adverse childhood experiences and experienced childhood trauma. Many of the children and young people that we support at our clinic that have had adverse childhood experiences display some type of risky behaviour. More often than not, these behaviours are serving the child in some way to communicate or get their needs met. They've developed from the adverse childhood experiences or childhood trauma that they've had. Parents and carers tell us that they often don't know what to look out for, or that they feel overwhelmed when these types of behaviours emerge. So here's 5 types of risky behaviour that could be seen from children who've had adverse childhood experiences and are suffering the effects of childhood trauma.
A behaviour commonly reported by parents, carers and schools is childhood aggression. This could be hitting or kicking out at others, pushing or throwing items. The type of aggression can vary in how it looks, how intense it is, and how long it lasts. Some parents report that their child will have short outbursts of aggression, and some report outbursts of aggression that can last for hours. This aggression can be directed towards anyone, but often it's directed at the person who's closest to the child. By closest, I mean the person who's emotionally closest to them, such as a parent, carer, or a close friend. Aggression poses a risk in several ways. The child or those around them could be hurt during the aggressive outbursts. Aggression can also have an impact on family and peer relationships, meaning the impact is far wider than just the aggressive outbursts themselves.
The second risky behaviour I'm going to look at is self-harming behaviour.
This type of behaviour can take various forms. In older children, this may be things like cutting or burning, which are easily identifiable as risky behaviours. Self-harming behaviour is often linked to emotional distress, and it's really important to think about what may be behind the behaviour and contributing to the self-harm. Self-harm is often thought of as something older children do. However, younger children can also display behaviour that could result in them harming themselves. This could be things like headbanging, skin picking, or really severe nose picking. Once again, for children who've experienced childhood trauma, these behaviours are often linked to emotional distress.
For us as adults, it's really important to be able to identify these behaviours so we can get the right support at the right time. The third type of behaviour I'm going to look at is absconding.
Absconding means leaving home or school without permission. When young people do this, their parents, carers or teachers often don't know where they are, which can be really worrying. This type of risky behaviour is often seen from teens who may abscond and go missing for hours or sometimes days. However, younger children can also abscond from home or school. There are many risks associated with absconding. The child or young person could have an accident, be harmed, or be taken advantage of by people they come into contact with.
Supporting a child who absconds can be so worrying for parents or carers. Absconding also goes hand in hand with the next 2 types of behaviours I'm going to talk about. The fourth type of behaviour I'm going to talk about is a lack of social awareness. However, a lack of social awareness isn't actually a behaviour. It's the behaviours that go along with that causes the risk and the worry. Things like approaching strangers, or the possibility that they may go off with strangers, or that they can't perceive risk in a risky situation. Let's take a look at that.
What can often fuel this type of risk is a lack of understanding or a lack of ability to differentiate between individuals or situations. Young people find it difficult to differentiate between safe individuals and situations and those that might be unsafe. This can include people whose intent is to do the child harm or encourage the child into situations where they could get hurt.
Unfortunately, many young people who've experienced trauma, particularly complex trauma, lack the ability to differentiate between those situations that are safe and those situations that are unsafe. This can make them really vulnerable. This can also happen with younger children or older children. It's really not just limited to younger children.
A lack of social awareness can also include being unable to navigate the world safely. For example, not checking if there are cars coming before you cross the road, engaging with people online without knowing they're safe, or having very little awareness of any risk in the environment.
This type of behaviour can impact children in a number of ways, but overall means that in social situations they don't always make the right call and they're not always safe. The last risk I'm going to look at is getting involved with alcohol or substances.
Children who have experienced trauma or have had adverse childhood experiences are often more vulnerable because of those experiences. They may be more susceptible to becoming involved with substances or alcohol. As adults, being aware of this can help us discourage or intervene at earlier opportunities. Substance misuse means misusing drugs, and alcohol misuse means drinking alcohol when you're too young to legally do so, or drinking alcohol to excess when you are legally old enough. Unfortunately, for many young people who are trying really hard to fit in with friendship groups, drugs or alcohol may look really appealing, particularly if their friends are all doing it. The risks associated with drugs and alcohol use can, however, be large. There's the obvious impact on the young person's health, then there's the impact on their ability to keep themselves safe while under the influence of these things. There can also be social risks, such as finding themselves in a situation where they're really vulnerable.
Unfortunately, this type of risk can also be compounded for young people who don't have social awareness skills. They may not have the problem-solving skills to be able to get themselves out of tricky situations, and alcohol and substance misuse combined with that can make them even more vulnerable. For them, they just want to fit in, they want to have friends, and they put themselves in situations where they could really be vulnerable to lots of risk because of the alcohol and substance misuse. The 5 risks I've talked about are really important to be aware of. They're not the only risky behaviours that come up for children who've had adverse childhood experiences or experienced trauma, but they are ones that frequently come up and can often be linked back to those experiences.
If your child or a child you're supporting is displaying any of the risks I've mentioned here, it's really important to have a robust plan in place to mitigate the risks to ensure everyone is kept safe. That's why one of the first areas we look at in Tribe is managing risk. We mitigate against risk first so we can then focus on providing trauma-informed care.
Here's one final trauma-informed care top tip. Risky behaviours can be really worrying for parents, carers, or anyone supporting the young person. If you're supporting a young person who displays risky behaviours, we really recommend tracking that behaviour. So how often it's happening and really making a note of that so you can see if there's any increases or decreases. This can help you identify when additional support is needed and also provide really valuable information to anybody providing that additional support. It can really help us be trauma-informed, monitoring what happened in the past, but also what's going on now for the young person to provide really effective interventions and support. So we always recommend tracking and monitoring any risky behaviours that are happening. For more information on risky behaviours and everything trauma related, subscribe to Tribe for trauma-informed care in practice.